everybody. So thanks to some help at home, I actually have the camera facing the right way this time. It is Saturday, April 25th, and it's been a while since I've been here talking with you. I'm going to try to make this short, but I've got a few updates. First and foremost, I'm sure that you want to know about the payroll support system and where that stands. And we let you know that there were, on April 14th, that there were agreements in principle with Secretary Mnuchin to move the program forward. The good news is that all of your efforts, everything that you did, the phone calls that you made a huge difference. And what happened was, going into that weekend, the program that Secretary Mnuchin had announced made it unlikely, actually, that the airlines were actually going to take the payroll grants, which would have meant that their only other option really was bankruptcy. And that's the last thing that we want to see here. That's what we've been working so hard to avoid, and to make sure that we are not subject to all of the harm that comes with bankruptcy and putting on our backs this crisis. So we worked really hard to put something in place that had never been done before. Just as a reminder, our payroll support program that's in the CARES Act is 1.25% of the $2 trillion that's actually allocated to go directly to workers. So we did something that was not only historic, it was completely unique. We wanted to put this in place so that actually it can be used as a template for every other industry, so that we can slow down those unemployment lines, keep people in their jobs, even if not on the job for now, keep them getting their paychecks, connected to their health care, connected to their other benefits, and able to go right back to work as soon as the threat has passed. So we had $25 billion that was $25 billion that was allocated for the payroll support program. And then that was not quite enough to cover all of the time period that was applied from April through September. They were taking the payroll data from 2019 and applying that to what would be needed to cover our jobs and our payroll through the end of September. So the Senate bill only allocated $25 billion, and the actual cost of that was between $31 and $33 billion. So before Secretary Mnuchin even started allocating the money out or getting these agreements with the airlines, there was a 24% decrease in what each airline could actually get. That took us down to 76%. And then on top of that, he turned a portion of the payroll grants into loans. And you know all of this, 30% of it turning it into loans, which is effectively stole $7 billion from us. So through our action, we were actually able to push that back to $6 billion, which made it sort of just enough for the airlines to take it. We also were able to get some other favorable terms in place so that they would take this money and that we would have the certainty of keeping our jobs through the end of September, which gives us time to plan for the future. What we are going to continue to try to do is to get a fix, to get that full $6 billion back to us, because no one has ever imagined this program before, that there could actually be a bailout that's a people's bailout, built from the bottom up, money that's directed directly to the workers, directly to the people who create all the value in our economy, and actually are the consumers and the taxpayers. And so it was, Mnuchin used that against us and tried to have people believe that he was protecting the taxpayers' money as opposed to holding back the taxpayers' money. That's our money. That's not his money. He's there to oversee it, but it's our money at the U.S. Treasury. So we're going to work to get that additional $6 billion back and fix this loan portion that lowers the amount that was actually allocated for us. Because once we hit the end of September, we're still going to be dealing with wherever we are in this coronavirus at that time, the low level of demand, and we're still going to have to deal with issues at that time. And we want to make sure there's as much money now to stave off the hurt in the fall as possible. So we'll come back to you with more of that later. But the other thing that I want to talk to you about is that many of you have taken voluntary leaves or voluntary furloughs and actually helped with the amount of money that's allocated to continue the payroll. So thank you all so much for those of you who did that. I know some of you are having a really frustrating time with unemployment, and remember that our unemployment Q&A is on afa-CWA.org/coronavirus on our resource page if you need any assistance there or need questions answered. But for those of you who are still flying or at least still active, we have, in many cases, contractual minimums that protect the amount of money that we're going to get. What some of the airlines with a low number of unions, aka Delta, are doing is actually cutting people's hours, because the CARES Act says that you cannot cut people's pay either. You have to keep them on the job and you can't cut their pay, their rate of pay. And so instead of making other cuts, they're actually cutting the number of hours that people are getting paid. So there actually is a petition that Delta flight attendants have been running to Delta management to say, match what's in the United contract, the 71 hours for line holders, or if you have us on reserve status, then it's a 78-hour guarantee. And so far, Delta has not agreed to do that. They have not, we don't have an example of cutting flight attendant pay yet, but they have been cutting back the hours for the ground staff. And so we need to keep the pressure up, because that's not really the intent of the CARES Act. The intent of the CARES Act is to keep people on that at least minimum level of pay, not cutting a minimum in half and expecting that people can live on that. That was not the point. The point was to keep a level of security there, a level of sustainability, a level of stability, so that we can get through this crisis and get to the other side. Now, this past week, we sent a letter to DOT and HHS asking them to go further on the list that we have had forever on dealing with communicable disease, and to go further by requiring that everyone in an airport and on an airplane wear a mask. And one of the reasons that we have been advocating that as the recommendation since the beginning, but now we're saying this really should be required, understanding that there are still supply chain issues, and we need to make sure that our healthcare professionals on the front lines have all the PPE that they need in order to safely care for patients. But recognizing that, to start to coordinate to make sure that everyone in an airport or on a plane is wearing a mask. And the reason for that is because we've had evolving information about the virus. What we know now in the last couple weeks is that there's actually fine aerosol particles that can stay suspended in the air for extended periods of time with the virus. And what's so concerning about that is that social distancing is the best way to keep from contracting the virus. But if you are passing through an area, say you let someone pass in front of you and then you walk through that area, if that other person was infected with the virus, they could leave those fine particles in the air that then you would pass through, which means that wearing masks is very important. Now, there's different levels of masks. There's the N95, which is going to protect you as the person giving care. There are the surgical masks that are going to protect you some, but mostly protect the people around you from any excretion, any saliva that you may be excreting from your nose or mouth. And then there is just a cloth mask, which is also going to help with that. It's going to help the people around you, and we're going to keep from spreading that on each other, but it's not necessarily going to protect each one of us. It's really about being thoughtful of the people around you. And since this virus, we also know, can be contracted from someone who is asymptomatic. Some people who contract the virus don't even know that they ever had it. Actually, they can just be a carrier and take it to much more vulnerable communities who experience death. And we've had a lot of really heartbreaking stories, losing some of our own among our ranks included, and some of our flying partners who are very sick right now and fighting in the hospital. And so we want to do everything that we can to protect each other, but we also need to make sure that we're doing everything we can to eliminate the risk and help contain the virus. And we can only control what we can control, which is transportation, specifically aviation. But we have to really bring everything down, respect those stay-at-home orders, And that includes bringing down as much of aviation. It's counterintuitive, really, because you think you want to save the industry by encouraging people to fly and asking more people to come out and buy tickets. The problem with that right now is that that actually aids in spreading the virus. And so now that we have this aid for the airline industry, we need to use this time between now and September to help our healthcare officials actually contain the virus. And so we need to be taking every step that we can to limit the exposure, to allow the healthcare professionals to get it to a place where they can contain the virus. And that is important because this is an effort that's going on around the world. There are, in Canada, more recently, within the past couple weeks, there is a requirement for everyone to wear masks in airports and on airplanes. And in other countries around the world, they've already been doing that for at least a month, if not longer. So we're actually lagging behind the rest of the world on these provisions. And we need to step it up and do everything that we can to get this under control in the United States. Because another concern for us in aviation, in wanting to get back to a set of normalcy, is that if the rest of the world gets the virus under control and the United States doesn't, what can happen is when we try to open up business again and try to create demand for aviation, even if there were people who were willing to buy tickets in the United States, we depend upon a worldwide network to make the airline industry work and to make it run, make it profitable. And other countries could actually refuse flights on U.S. carriers or people traveling from the United States if the United States is still a hot spot when other countries have gotten the virus under control. So these are some of the threats that exist for us and why we have to take it so seriously and follow the instruction from the healthcare authorities. And this is why we are encouraging HHS and DOT to coordinate on this effort. One of the things that they need to do as well is coordinate on bringing down as many flights as possible and encouraging no leisure travel at this time, to suspend leisure travel at this time. Now, a lot of people have said, how are you going to enforce that? You're not going to enforce that by individual tickets. What you're going to do is say, as an industry, from the leadership in government and from our airlines, that no one should be traveling right now unless they have an explicit reason to travel. And that could include things like traveling across country to take care of children because someone is sick and in the hospital. That is certainly an appropriate form of travel at this time, but with all of the precautions to travel safely. So what we need to do is coordinate both on proper PPE to stop the spread while we're transitioning through airports and on airplanes, but also take down as many flights as possible in a coordinated way. And DOT and DHS have been doing, or DOT specifically, has been doing some of that with the airlines by walking through an exemption process. So airlines put in for a set of exemptions, mostly seasonal flying, so that they're not required to do specific flying right now that there's no demand for and actually is a greater cost to the airline than to keep that plane on the ground and not have the cost of operating it because there's not enough revenue to support it. So we are encouraging that goes a step further. When the CARES Act was being written, in the House, they actually had a provision for antitrust immunity. Chairman DeFazio had written that and had thought ahead and was very proactive about getting that language into the bill. When the process was shifted over to writing the bill in the Senate, which is not really the appropriate way to do a spending bill, but that's what happened, that language did not transition over. So that makes it very complicated because that gets DOJ involved and there's no ability for the airlines to coordinate together on pulling down as many flights as possible. So we keep the essential service going to all of our communities, but we don't run any additional flights if we're already serving that location with one of the airlines. We don't need to be serving it with multiple airlines and only carrying a few passengers on those planes. So that's the idea behind it. We're going to be working to get that antitrust immunity, and we put that in our letter to DOT and HHS, saying that we understand you need this in order to coordinate with the airlines on that. So we are working with government on this and with lawmakers and also with our airlines. but we are working to do our part in aviation. Now, we're also working, we are essential workers, and like I tell people all the time, flight attendants feel tremendous pride in doing our job as essential workers and being a part of providing that essential service, especially during this time of national and worldwide crisis. And but we need to be recognized as essential workers, just like everyone else who is on the front lines right now, keeping the basic needs of our communities going. And there has been talk about providing hazard pay to essential workers. So I want you to know that we are promoting that, we are asking for that, and we are pushing for that. And we'll have an update for you later next week on where that stands, but I want to make it very clear that we are absolutely promoting that. Now, the next thing that is really of concern, that we should all be concerned about, is the United States Postal Service. We carry the vast majority of U.S. mail on our planes. It is a huge revenue driver, actually, for U.S. airlines. That's number one. Also, though, as citizens, we count on this service. There's $1.7 trillion of economic activity in the United States driven by the Postal Service. It provides the logistics and delivery infrastructure that supports 7 million jobs in our country. And the Postal Service itself employs 600,000 workers who are mostly union workers with good union jobs. In fact, I know there's many flight attendants who have told me they are married to a postal worker or they have a parent who's a postal worker. We have a lot of connections because our postal workers are in every single community, and actually we have a lot of common experiences together. But, you know, the Postal Service delivers to 160 million households 6 days a week. And there has been some talk about raising the rates to cover the drop in demand for the Postal Service. And the drop in demand has been the drop in demand of mostly of advertising, and which is also a problem for our media sector. So that is going to drop while businesses are not operating and they're not able to advertise their businesses and their services. So there's a natural drop in demand for Postal Service revenue, and that has to be shored up just like the airline industry was shored up so that we don't lose this essential service that has been in place longer than the U.S. Constitution and is actually enshrined in our Constitution. And the reason that it is there is because we have to be able to communicate with each other and send packages in a way that doesn't discriminate. This is not something that should be as a competitive edge where service could be dropped because there's not enough demand because it's a rural area, or if it's a particular community that can't afford shipping from one place to another or has less access to funds, those rates should not be increased. And certainly the rates should not be increased on the American people today in the middle of this crisis when everyone is taking a hit to their pay. The biggest issue with the United States Postal Service is that it is the number one way that people get prescription drugs. So 1.2 billion prescriptions are delivered through the United States Postal Service and 4 million a day. Think about that. And there are people among our ranks who have drugs that they receive at home to help them battle cancer. There is insulin. And other very important life-saving drugs that are delivered. And so we need to make sure that those costs don't go up for people and that service is not available because our postal service is undermined, privatized, and really run out of business. They will run out of money. The United States Postal Service will run out of money sometime between July and September if Congress doesn't take action. So that's why you're going to see a lot from us about the essential workers. And as you know, you've seen them. They have continued to work. They are on the front lines. They are essential workers. There have been several deaths actually at the post office and with the letter carriers. But they are continuing to provide this essential service to us, and we need these packages delivered at our homes, and we also need it to serve as a counter on other shipping services because that keeps those costs lower too, because the Postal Service exists. So we're going to support our postal workers, and we're going to do this in a lot of different ways. There is an email that went out yesterday where you can sign a take action letter to Congress, but we need to raise the recognition of what this service provides for the U.S. and why it's so important that Congress take action on this. And so what I would ask you to do as a fun thing is to get out your phone and keep your social distancing going, but be on the lookout for your letter carrier and maybe get on video a little thank you to them, and then send that in to us we have a new website actually called, not a new website, a new email called crewlife@AFA